Okay, so firstly, congratulations ODP students, you're nearly there. So just a couple more assignments to go. We're making this vidcast to help you with your case study assignment for your managing post-anaesthetic care module. So I wanted to say to start with that because you're nearly there, I don't want you to just kind of stop. I don't want you to give up now. I know some of you have already got jobs and you can feel like you're almost across the finish line, but don't try and coast with this assignment. Don't try and coast through. It's a 4,000 word assignment, so it's quite a biggie. Aim to do the best that you can, just as you do in your profession, so that you can leave uni with the highest mark that you can possibly get. So what we're going to do in this vidcast is I'm just going to remind you of a couple of things that we've already had classes about, and I'm going to point out to you the challenges for your upcoming assignment. So the challenges actually lie in the literature review and discussion section, so we'll look at those first. With your literature review, you have a challenge in terms of the search strategy. So you're being asked to explain what your search strategy is. So thinking about your terms that you've used, the databases that you've used, but also don't forget those inclusion and exclusion criteria. So for example, think about how you've ruled out some of the papers that came up on your searches. So, for example, did you rule out studies that came from other countries? And if so, why? Or did you look at studies that only related to women? So you ruled out the studies that related to men, and if so, why? So what we want at the end in terms of your search strategy is what literature you ended up with and why you made the decisions that you did to end up with that literature. So that's your first thing to note, is to make sure that you include your inclusion and exclusion criteria and that you explain why. And the second thing is to do with the strengths and weaknesses. So in your literature review, you're being asked to look at the strengths and the weaknesses of the literature you've found. And again, if you remember from the class that we had at the beginning of the year, you've got to say why. So it's not enough to just point out, say, a flaw with something. You've got to explain why it's a flaw, even if it's quite obvious to you. Your markers can't do that reading in for you. So for example, you found a study and it's only got 3 participants, and you might think that's a serious problem, and it probably is, but it's not enough to just say there's a problem with this study, it's only got 3 participants. You need to explain why that is the issue, why that is a problem. So what you might do then is, if you've said it's only got 3 participants, you're not an expert in study design, so you would go and find a book about study design that could back up what you've got to say and would explain why having only 3 participants is not appropriate for this kind of a study. So whatever it is that you're saying, whether it's a strength or a weakness, remember to say why. There's actually kind of 3 ways that you can make points about strengths and weaknesses for literature. One is to point it out yourself, point out the weakness yourself, in which case you've probably got to develop your argument and find some references to back you up. Another way to point out a strength or a weakness is to look at what somebody else has said about, say, the study, about the piece of literature, and you can include their reference. Again, you might want to back yourself up, you might want to explain it a little bit more. The third way to point out a flaw is to look at the person who's written the study themselves, because usually in the limitations section or in the discussion section, the authors will talk about the limitations of their study, and then you can point out a weakness so long as you put the author's reference there. But again, you still might want to expand on that, and you might want to explain why it's a weakness. And again, if you need to, you can back yourself up with some other references. So they're the main challenges. So getting your search strategy so that you can explain why you've made the decisions that you have, and putting in the strengths and the weaknesses and explaining why they're strengths and weaknesses. The other thing to remember is in terms of grouping the literature. Now, I know you've been asked to identify a couple of themes, so you can group literature in terms of the themes, but you can also make smaller groupings within that. So you might want to group studies in terms of the kinds of study that they are. Or you might want to look at policies and guidelines separately from studies. So smaller groupings of the literature as well in your literature review section. The next section that has some challenges is the discussion section. So if you take a look at your guidelines for the assignment, you'll see that the discussion section is really a kind of compare and contrast section. Now, that we had a class about comparing and contrasting last year, if you remember, in Level 2. So the thing to remember, I'm just going to remind you here, is that when you're comparing and contrasting, say with studies, what you need to do is explain how the studies are similar or how they're different and why. So it's not enough just to say study X found blah 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 and study Y found whatever study Y found. It's not enough just to talk about the two things, even if it seems obvious to you what is similar about them and what is different. You still need to bring them together in a compare and contrast section in an assignment. So you need to say how they're similar, how they're different, and if you can, if something's different, then say why. So, or at least suggest why. So if you've got two studies and they've aimed to look at the same kind of thing, but they've found quite different results, they've got quite different outcomes, you can look and see if you might be able to suggest why they might be different. So for example, you might look closely at those studies and see that the kind of participants that they found are actually quite different, and that might explain why. So see if you can do that. Always remember that unless you've got absolute ironclad evidence, you need to be fairly careful in your language when you're explaining why. You're just really suggesting that this might explain the difference. So be careful with your language there as well. So just as with studies, you can compare and contrast. You can also compare and contrast the care that you have provided or you've witnessed with what the literature is saying. And again, what you need to make sure that you're doing is not just describing your care and then describing what's best practice in the literature, but explaining how they're similar and how they're different, and if they are different, suggesting why they might be different. So bringing them together, explaining how you've done something that is very similar to what the literature has described, or how the practices in the hospital where you are on placement have something that's different, do something that's different. How is it different? Bring those two aspects together. Don't just treat them separately, because your lecturer can't pull them together for you. Okay, and finally, we've got the introduction and the conclusion section. And you can see from your guidelines that in your introduction section, you're being asked to build up your case study there to explain what the patient's condition was, the kind of care that they received. But also remember that in your introduction, it is an introduction to an assignment, so you can also explain what you're going to be doing in the rest of your assignment. And finally, in the conclusion, you're asked to look at the best way to manage your patient's care, and to think about how your learning from your literature review will influence the way that your practice is done in the future, and that of your teams as well. Okay, so they're the main issues that you need to be looking at for your assignment. I'm just going to wish you the very best of luck for your final assignment and also for your careers as ODPs. So congratulations, guys.